Hi, I'm Frank Keefe. I'm Editor-in-Chief of PAIN, and I'm here to provide you with the second in our series of video introductions to an issue of PAIN. These introductions provide an opportunity to highlight some of the special articles published in each issue, as well as some key basic and applied science research articles. In terms of special articles, we have two reviews in this issue. In the first, a comprehensive review by Kaya Peterman and colleagues. A review is done to examine the effects of interventions designed to alter pain expectations. Two key findings emerged. First, moderate to large effect sizes were evident when these interventions were used for experimental pain or acute procedural pain. Smaller but still significant effect sizes were obtained, however, when these interventions were used to alter pain expectations in individuals suffering from chronic pain. The second review is a topical review by Anna Taylor and her colleagues, which examines the role of the mesolimbic dopamine signaling system and in pain. And a key feature of this article is an extensive discussion of implications of recent findings in this area for our understanding of motivation, analgesia, and addiction in the context of pain. This issue also features an article in our Pain Pictured series by Isaac Chu and colleagues. It examines pain in an infection and highlights the role of pathogens in activating nociceptives. Just to remind our readers, the Pain Pictured series includes a pain pictorial that you can download as a PowerPoint slide and use in your presentations. The final special article I'd like to highlight is an article in our Pain Classics series by Rolf Detlef Treaty that highlights developments in the field since the publication of the gate control theory article by Melzack and Wall in 1965. And a particular focus of this article is the role of gain controls in increasing and decreasing sensitivity of the nociceptive system. Moving on now to some of our basic science papers, I'd like to highlight two papers. The first is by Marie-Céline Rietz et al., and it consists of a behavioral study of pain sensitivity. And a very novel feature of this article is that it directly compares and contrasts mechanical hypersensitivity in rats and humans using the identical test stimuli. The second basic science article is by Jean-Marc Guidon et al., and it examines the effects of analgesics on skin sensitivity and bone pain. A key finding is that while analgesics may reduce skin sensitivity, these reductions are not always associated with reductions in bone pain. And now let's take a look at a few applied science articles. There's two I'd like to highlight. One is by Karen Jensen and colleagues, and it consists of a meta-analysis of neuroimagery studies of pain in both patients and healthy controls. And these neuroimaging studies highlight the central role that the anterior cingulate cortex and insular activation play in the pain experience. An interesting aspect of these findings is that they were not dependent on the modality of pain stimulus used, the body part being tested, or the clinical experience of the participant. The other applied science article is an article by Tanya Palermo and her colleagues, which is a pilot randomized controlled trial of a problem-solving skills training intervention for parents of children having chronic pain. The findings of the study support the feasibility and acceptability of this intervention. They also provide preliminary efficacy data showing the effects of this intervention on both important parental and child outcomes. In closing, I'm pleased to have this opportunity to highlight a number of articles in this issue, and there are certainly a number of other basic and applied science articles that I'm sure you will find of interest. In closing, I'd also like to thank you for your continuing support of PAIN, both as readers, contributors, and reviewers. Thank you very much.